It's the medical appointment most would rather put off. For many people, childhood experiences at the dentist have meant they've skipped too many visits as adults. But experts say today's dental practices are vastly improved, and dentists have more tools than ever to ensure a patient's comfort.
One of the biggest game changers has probably been the local anesthetics that have come out. The anesthetics that we have now versus 10, 15 years ago are just so much better. So the things that they're great at is they provide a much more profound anesthesia. So the biggest thing that patients fear is they don't want any pain. They don't want to be uncomfortable. So if you can eliminate that portion, the patient experience is going to be amazing.
One of the most impactful advances in dentistry is the use of local anesthetics. These numbing agents greatly enhance patient comfort. While patients commonly refer to dental anesthetic as Novocaine, that's actually a misnomer. Novocaine was a treatment used decades ago. In fact, most people have never received it at a dental office. Today's dentists have a variety of different anesthetic options.
Well, anesthetics are designed differently. So you have a wide variety of medicines that you can use that are short-acting or long-acting. So that means that if you have a procedure that's going to take you several hours, you obviously want an anesthetic that's going to last the entire time, and halfway through you don't have to stop and start and do everything all over again. So that's one of the biggest differences between the anesthetics.
While local anesthetics deliver superior patient comfort during treatment, afterwards, their lasting effects can be a nuisance. Patients often complain about drooling, word slurring, or cheek biting that lasts for hours after an appointment is over, and makes it difficult to resume working, eating, or drinking. Now, a procedure is available that reverses numbness in half the time. First approved in 2008, Oraverse, phentolamine myslate, counteracts local anesthetics so patients can regain feeling and resume their normal activity sooner.
Oraverse is really appropriate for just about any procedure that you're going to do. The big caveat to it is if there's a particular reason that you want the patient to stay numb, maybe for pain control after heavy-duty extraction, yeah, you're probably not going to want to use Oraverse. But for pretty much your bread and butter dentistry, if you're doing fillings, crown and bridge, root canals, anything else, Oraverse is a fantastic product to use.
I think when dentists first learn about Oraverse, they're somewhat skeptical. It's so new, it's so different than anything else out there. It's when they start talking to their patients that they really understand the value and the need that patients have for this type of product.
It's especially beneficial to patients with medical needs who must eat on a schedule, or people with mental disabilities, or children over the age of 5 who may bite their lips and cheeks while they are numbed.
In the past, we had a lot of patients that would come in where the mom would come back and say, you know what, little Johnny actually bit the side of his lip and it can get pretty bad. The number of times that's happened on patients that I've used Oraverse on, 0.
Oral health is an integral part of overall health, and the dentistry field is working hard to make oral health care more comfortable for all patients.
I believe that Oraverse will be standard of care in dental practices at some point in the future. Every dentist should have this in their practice.
For many years, Septodont has been the leading manufacturer of innovative, safe, and effective solutions for dentists. Today, Septodont delivers a broad array of innovative products that help dentists deliver better care while increasing patient comfort.
Our vision as a company is to provide innovative, safe, and effective solutions for dentists worldwide. Oraverse fits that category very well. We try to solve problems that dentists face every day, and for them, we want to provide predictable outcomes for their patients and extreme comfort for their patients. Septodont is the world's leading manufacturer of dental pain control products globally. We're able to achieve this due to our manufacturing process. Today, we produce over 500 million dental cartridges for the industry annually.
Septodont is the leading manufacturer of local anesthetics in the world, and Oraverse is the first and only local anesthetic reverse agent for dentists. For dentists, these products are invaluable tools they use every day.
No other office in our area is really providing this type of service, so we get a lot of referrals and people coming in because they know that we do things to the highest standard. If I'm going to be a patient in a dental chair, I want to be comfortable. So that means I want to have good local anesthesia. Well, when it's done, I don't really want to be numb for 2 or 3 or 4 hours when the procedure's over. And the reality is, I don't have to be. all you have to do is use some Oraverse. So when I talk to my colleagues, that's exactly what I tell them is, why wouldn't you use this? Don't you want to be the best? Don't you want to provide the best care that you can for your patients? Well, if you're not using this product, I'm not sure that you are.
Septodont adheres to strict manufacturing guidelines set by the FDA, so doctors and patients can be assured of product safety. For more information about Septodont revolutionizing dental treatment, visit septodontusa.com. Adverse reactions to Oraverse include post-procedural pain, injection site pain, racing or slowing, or irregular heartbeat. Oraverse is not recommended for use in children less than 6 years of age or weighing less than 33 pounds. You may not want to use Oraverse if you have a history of heart disease. Ask your dentist for more information.